So we're going to talk here about some of the fractures that you run into, particularly if you're in the trauma bay or in the ED. You're going to see these quite a bit. And this set of slides is just going to be focusing on general fractures, so they can really happen to anybody. We're going to talk about fracture presentations, fracture types, which is where we're going to spend the bulk of our time talking, and then fracture alignments. The pediatric fractures, we'll talk about that's going to be focused on mainly growth plate fractures, which of course our growth plates ossify once we reach skeletal maturity. And then we'll talk about the supracondylar fracture of the humerus, which is a particular fracture we see in children as opposed to adults that has some significant implications, and it comes up really commonly on the USMLE. But for this set of slides, we're only going to be talking about the general fractures. So just as a caveat, you should remove the term broken bone from your vocabulary. It's not an orthopedic term. All breaks of the bone are fractures, but the degree is going to vary. So where a lot of people get confused is whether the fracture is incomplete or complete. A lot of people refer to an incomplete fracture where the fracture hasn't gone across the entire bone as a fracture versus a complete fracture as a break. That's not the correct terminology. So an incomplete fracture, the fracture has only gone across some of the bone, whereas the complete fracture, it's transversed the entire length of the bone, either in the X direction or the Y direction. How do we classify a fracture? Well, of course, we have to know where it is. So tibial, third metacarpal, femoral, humeral, etc., etc. So we need to know where it is. That's going to be first how we classify the fracture. Secondly, we need to know how it's presenting. Is it a closed fracture or an open fracture? Closed fractures are within the body. Open fractures penetrate the skin, and you would see the bone on presentation. That's pretty dramatic, so it's pretty easy to differentiate the two. The type of fracture is going to be what we spend most of our time talking about here. There's the non-complex fractures, which are, you could think of them as the non-complex fractures of just one line of damage, whereas the complex fractures, there's multiple lines of damage. And then a greenstick fracture is typically seen in children, and that doesn't really fit into either category. And then by alignment, if you have a complete fracture, you're going to want to know if the fracture is in union, or if it's in non-union, or if it's in male union. Now, if you're an orthopedic surgeon, you'll probably say this is a little too simplistic, but for the purposes of the USMLE, this is as much as you need to know. So here's some presentations that we can see. So here's an open, or sometimes referred to as simple fracture, and this is just a fracture that stays within the leg or the arm or wherever it's supposed to be. Compared to an open fracture where the fracture actually causes the one part of the bone to pierce the skin and exit the body. So if you were looking at this patient, you would see bone when they come in. That's an open fracture. Hopefully that's clear enough. So some general fracture types. We'll talk about transverse, oblique, spiral, and avulsed. Those are the what you could say the non-complex fractures, in as much as they only involve one line of fracture. And then the segmental and comminuted fracture. Those are fractures that involve multiple lines of fracture. And then the Torus and Greenstick fractures are sort of a little bit of outliers. Okay, so let's first start out. Probably the most recognizable fracture is the transverse fracture. This is a fracture that occurs at a right angle to the long axis. So this bone can be any bone, any long bone, and you draw the line at the longest part of the bone. So in this case, it would be down this way. And it's a transverse fracture if it's occurring at roughly a right angle to that long axis. So this is a transverse fracture, and this happens because of a sharp direct blow. And that makes sense because if you think, for instance, your femur, in order to get a this kind of linear fracture of the femur, you would have to go straight at the femur as opposed to at an angle or a twisting motion or something like that. So this is a direct, sharp blow to the bone, 90 degrees to the long axis. There is a category of fractures that we see a lot in sports medicine called stress fractures or hairline fractures, and what those are just small transverse fractures. You see those a lot in people who, for instance, start exercising and maybe they're a little overzealous. They start a running routine where they're running 3, 4, 5 miles a day, putting a lot of stress on their tibia, on the bones of their foot, and the bones can't handle it. They're not strong enough, and so it causes a transverse fracture. We'll take a look at those and how to differentiate those out. So here's a transverse fracture. This is complete, and this is of the femur. Here's another one. Again, complete. Okay, now here's our stress fracture, the hairline fracture. Now what I want you to know is that if a patient has had the symptoms of a stress fracture, and by symptoms I mean a history of having started an exercise routine, or they're involved with sports and now suddenly they have severe pain on bearing weight on a particular part of their body, that may be a stress fracture. However, you're not going to see x-ray abnormalities until around at least a week after their symptoms started. And that's because they don't really have big enough fractures for us to see on x-ray. But what we do see is the healing. And this healing will be noted by the ossification. So you can see that this patient has had multiple fractures, hairline fractures. The one it's pointing to is here. It's not really obvious, but there's another one right here and another one right here. So this is probably a runner. This is on the foot here, around the ankle. And so this is probably somebody who started running and got a little bit too into it and wound up causing some hairline fracture. So this is extremely common. And you probably see this in outpatient practice. But you can't detect it on x-ray. It will not look like this kind of transverse fracture. It won't look like, it won't be identifiable until after the healing has taken place. Here's another one. You don't really have to worry about what it looks like on MRI, but again, you can see right here, you've got a transverse line of healing, and down here you can see multiple. Here, here, and up here. Just these transverse lines of healing, and those are from stress fractures. Now the oblique fracture is diagonally oriented, whereas our transverse fracture was at a perpendicular angle to the long axis of the bone. The oblique fracture is diagonal. So in this case, we have a diagonally oriented fracture, and this is due to a sharp angled blow. That makes sense because that's the direction you would have to go in to cause a diagonal fracture. So rather than having a direct blow, you would have an angled blow, and that causes this diagonal fracture. So here's an oblique fracture, complete. And there's another oblique fracture. This one looks incomplete. It might be complete. It's really small. It looks like you also have a transverse fracture over here too, possibly. And then here's another oblique fracture. So where exactly you start saying they're oblique as opposed to transverse, I wouldn't worry about. Just know that if it's roughly perpendicular to the long axis, it's transverse. If it's diagonal, it's oblique. And here's another one of the metacarpal. Okay, so the spiral fracture is a little bit different, similar to an oblique fracture in that it appears diagonal, that there's a diagonal lesion of the bone when you look at it on x-ray, but it's different in that this is caused from a twisting force. And if you actually look at the x-ray and you look at enough dimensions, even if you look at one dimension, you'll note that there is this different pattern, this different surface underneath the fracture, and it appears almost helical. And that's because of the origin of this fracture, it's caused from a twisting force. So this has a high specificity for child abuse for two reasons. One, children don't engage in activities that cause twisting. Two, if you have a parent who you tell them, okay, your kid has a fracture, and they say, oh yeah, that must have been because my 5-year-old fell off the monkey bars, or my 3-year-old fell off the couch. That's wrong. You don't get a spiral fracture from direct impact. It happens because of a twisting force. You need some torsion involved to get this spiral fracture. So here's your spiral fracture. You can see here that you've got this sort of helical surface on both surfaces of the bone that has been fractured. So if you look here, this isn't just simply a transverse or an oblique fracture where you've got just if you were to take imagine taking a piece of big long French bread and cutting it diagonally. That's different. What you've got here is a twisting force. So now what you've got is this sort of roundish diagonal surface. I'm trying to describe this as best I can. Hopefully by looking at it, it makes sense. Here's another one. Again, you see this sort of helical surface here. And then this transverse fracture right here. And then here's another one. I happened to read the case history on this particular patient, and this patient got this humerus spiral fracture from arm wrestling. So certainly there are things that you can do that can cause spiral fractures, but they're not things that younger children who are at risk for being abused are going to engage in. So things like certainly arm wrestling, where you may be in awkward positions that may cause twisting on your leg or arm. Working with heavy machinery, if your arm gets stuck in a certain position but the machine continues to twist, that can cause a spiral fracture. But it's usually really unusual things that cause these types of fractures, whereas the oblique and transverse fractures are caused from direct impact. Now the avulsed fracture usually occurs near a tuberosity, and the reason is because a tuberosity is generally attached to or from a ligament. And what happens with these patients is that they get portions of the bone that break off from the main bone, and that portion is usually a tuberosity that's attached to a ligament. So if, for instance, the patient is contracting a muscle that puts stress on that ligament, and then they get some kind of direct impact on the bone beneath it, the site of breakage could be near that ligament because you've got support for that tuberosity, but you don't have the support for the rest of the bone, and so the breakage is going to be near that tuberosity. So this occurs particularly in athletes near ligaments. So here's an avulsed fracture here of the lateral epicondyle of the humerus. Here's another one on the foot. This one's pretty subtle. And then here's another one of the lesser trochanter of the femur. You can see here that you've got some avulsion. Like I said, these happen near tuberosities because what do tuberosities do for the most part? They receive tendons. Now a segmental fracture, now we're getting into the more complex fractures, for lack of a better word, where these fractures, you have multiple fractures on the bone as opposed to just one line. So a segmental fracture occurs because you have multiple similar fractures, not a single point of fracture that radiates out, which we'll see when we compare it to the comminuted fracture. So something, for instance, a car accident that puts multiple different stress points on the bone, multiple traumas to your femur or your humerus, for instance, it can cause two transverse fractures. or it can cause 2 oblique fractures, or it can cause a spiral fracture and a transverse fracture. The fact is that you've got multiple fractures on the same bone, and that causes it to be broken up into segments, and that's where we get the word segmental fracture. So here are some good examples of segmental fractures. Here we've got a transverse fracture and then an oblique fracture here, and so this is a segmental fracture. Whereas this bone here, you only have looks like a transverse fracture. So this is a segmental fracture. Sorry, lost my words there. This is a segmental fracture in that you've got multiple fractures on the same bone and it breaks it up into segments. That's the best way to remember it. Here's another one. Looks like here you might have either a oblique fracture or a spiral fracture, and here you have a transverse fracture. And this is just the process of reducing this bone back into the position that it's supposed to be in, and then there was fixation. So generally these more complex fractures, such as the segmental fracture or the comminuted fracture, are going to require more invasive therapy. Now the comminuted fracture is more of a shattering, and it's generally the result of a single force, but it's a force that's so heavy that it causes this shattering. So a great way to think of what can cause a comminuted fracture would be like a bullet. So with a bullet, you've got super high force, but it's applying it on one area, and rather than just getting a breakage, you've got such a high force that it's spreading out all of that impact to the surrounding bone. And so the comminuted fracture is just this sort of this kind of like shattering or a webbing that you see here. So let's see a better example. So this is obviously a little bit more severe, but it's comminuted because it occurred from one blow. So you don't have those multiple lines that you see in the segmental fracture where it's occurring in distinct areas. Here it's fracturing into multiple different pieces, but it's all at one spot. And then here's another one. So you could consider this up here. You could consider this a segmental fracture, but right down here, this would be a comminuted fracture down here. So you're getting multiple different breakages. Hopefully, I made that clear. If you have any questions, let me know. So right here, this is your comminuted fracture down here. If you put these two together, then you could consider it a segmental fracture. But right here, this is a comminuted fracture. It was one blow that caused multiple different fractures in that one area, causing many pieces. Okay, the torus fracture is a little bit different, and this is really subtle, and so you have to really pay attention, especially to the history. So a torus fracture is a compression fracture of the bone, and it results in bulging or bowing of the bone. So usually there's going to be some level of compression to a particular bone that causes this. So here you can see there's a little bit of bowing right here. This is a fracture, but it's the only thing we see of it is just this little bulging right here. Here's another one right here. And right here is right up here. So I would say that the torus fracture would be least likely to come up on a USMLE, but I would know what it is. And it's pretty subtle. Okay, the greenstick fracture is caused from a bending force on bone. And this is usually going to happen in children because their bones are softer. Now, if you had a bending force in an adult, what would normally happen would be, well, they would probably get either a transverse fracture or an oblique fracture. But with children, their bones are so collagenous still that they don't break completely, or they don't show as much trauma. So let's look at an X-ray. So here's this is a Greenstick fracture, and you can see here that you've got a bend to this bone, but you don't have the same kind of fracture that we saw in the transverse fracture where it's separated. You just see a little bit of trauma, but the bone itself has been bent. And same here, you have bending of the bone, and then you've got this little tiny fracture here. So a Greenstick fracture results from bending of the bone, and it happens in children because their bones are more collagenous, which means they're less likely to break. Collagen doesn't break like mineralized bone does. Okay, here's another Greenstick fracture. Just a little tiny fracture. You can't really see as much of the bending here, but just this little tiny fracture. If you just see a little tiny fracture that looks like it might be a transverse or oblique fracture, but it's just really small and it's in a child, look for the bending of the bone around it. That will usually mean that it's a Greenstick fracture. But the bending might not be as obvious as like in this one. Okay. Now, fracture alignments, this is really important to know about because this is going to dictate whether the bone heals properly. So a fracture that's in union means that the fracture has occurred, but it's in a healing process. And it's important that the bone be aligned properly so that when the healing happens, you don't have any abnormality of the bone. If, for instance, you were to have healing of this malunion fracture here, where the bones aren't in alignment, then you would wind up having you'd have healing here, and maybe here, so you would have a abnormally shaped bone after it heals. And so this is why surgeons reduce the bone into a union position so that they're lined up properly. A non-union fracture would be a fracture that's in alignment, but there's no healing that's taken place. So you think of union as the union healing the two parts of the bone that have been fractured from one another. Non-union would just mean that there's no healing that's taken place, and malunion means that you can't get any normal healing because they're out of alignment. So here's malunion, and that makes sense because these bones are out of alignment. Here's union. As we see here, this bone has been fixed into place and we no longer have fracture. And then this is a healed bone. This may have been, for instance, I would say this probably was in union when it healed, but what we see here is this callus. And a lot of times you can see what appears like a callus if the bone was slightly out of union, just because you're going to get bone development around to try to get the bone healed up. The body doesn't care if the bone is in union or not. What the body cares about is getting the bone healed. And so if the bone is in malunion, you can get healing, but the healing that you'll get will be not what you want, because it's going to work around the bone and you'll have an abnormally shaped bone. That's pretty much it for fractures.